Good evening. Thank you very much for joining us here on Urban Debate on Mirror Now. I am Heena Gambhir. Budget 2022 is just a few days away, and from today onwards on Urban Debate on Mirror Now, we will bring you up to speed with the expectations of various sectors from Finance Minister Nirmala Sitharaman. With Budget 2022 being the second budget amid a pandemic, we want to begin with the healthcare and pharma sector. 3 waves of COVID in 2 years have made the healthcare a priority for people as well as policymakers. Do you know that United States of America spends almost 17% of its GDP or gross domestic product on public healthcare? Countries like Canada, Japan, France, Germany, Australia, etc. spend around 10% of their GDP on healthcare. But in India, it is quite low at about 1.2% of the GDP. In fact, the budgetary allocation for health sector last year was increased to 2,23,846 crore rupees for the current financial year 2021-22 as compared to the outlay of about 94,452 crore rupees in 2020-21. And this was around 137% higher. This happened in the last budget. So did this increase in allocation help the sector? And what is it that the sector is expecting this time from Finance Minister Nirmala Sitharaman? From a budget amid the third wave of COVID pandemic. Let's ask our experts joining us on Urban Debate this evening. We have with us Dr. Harsh Mahajan, founder Mahajan Imaging Diagnostic Imaging Center, Dr. Naresh Trehan, cardiologist, Medanta Hospitals. We have Pradeep Multani, President, PhD Chamber, Chairman, Multani Pharmaceuticals, and also joining us on the broadcast this evening is Professor Anupam Sibal, Group Medical Director, Apollo Hospitals and Senior Pediatrician. Thank you very much, gentlemen, all of you, for joining us here on Urban Debate on Mirror Now. Dr. Naresh Trehan, I want to begin the discussion with you. Now, health expenditure was increased significantly during the budget last time, 137% higher. How did the country really benefit from this increase?
Okay, so please repeat the question. Breaking now, I'm putting my headphones on. Hello?
Okay. I shall repeat my question, sir. So we know, yes, so I was just trying to ask you, sir, that the allocation to healthcare sector during the budget last year was increased by about 137% to about 2.23 lakh crore rupees. Could you tell us how much did the country benefit with this increase in budgetary allocation, in your opinion?
Of course, you know, the fact that all the infrastructure that is being put in for the future of healthcare, like 56,000 crores went to building the infrastructure over the next 3 to 5 years. So there are many, many things that were put in place which will benefit India immediately and in the long run, most definitely. Also the fact that it helped us to tide over the horrible second wave that actually shook the whole entire healthcare system of the country. So I think that it was a very timely increase in budget. There was, it has a short and long-term effect of actually equalizing. If you look at where we are as compared to what is required for a robust healthcare system for any country, we are about half of that amounts in everything, whether it's doctors, whether it's nurses, whether it's the infrastructure, whether it's the technology. All these things have now got an impetus. The government has announced many more aims so that every state can have even more than 1 or 2 aims to serve the public at that level. Ayushman has been actually given another boost, and the completion of that whole project by way of opening up the wellness centers, which was announced as 150,000 of them, has got the impetus, and a large number has already been laid out. So I think that it was a very good move by the government to increase the budget. And of course, the fact is that with what has been going on lately, which shows us that we have still a huge demand, unmet demand left in the healthcare sector, that we are expecting that this next bold step will be taken in this budget to get to at least 2.5% of the GDP.
Okay. So you're saying that the next bold step that the sector requires is supposed to be taken in this budget, can be taken during this budget. I'll talk about that bold step in just a bit. Let me first take the opening comments from my other guests as well about how much did this increase in budgetary allocation in the healthcare sector last year actually helped us in the middle of a pandemic that we were in this year. Dr. Mahajan, your comments.
I think I tend to agree with Dr. Trehan that it was very timely and it has helped. And we've seen that infrastructure across the country is now much better. We are much better prepared now, whether it be diagnostic, whether it be hospital beds to fight COVID, oxygen plants which have been set up in both the public as well as the private sector. And also the fillip on, clean drinking water and hopefully in the years to come, sanitation. Because ultimately, the focus of the last budget, apart from meeting the, needs during the pandemic, was also to create long-term impact. And also there was a focus on preventive aspect of medicine, and that's why the water, clean water, sewage disposal, they were all kind of linked with healthcare, something which is common sense, and this was done in the last budget. Having said that, I think a lot more needs to be done. There are certain aspects where we've met the government, we've given suggestions, and we hope that if, as the government has committed to 2.5% of the GDP being brought into the healthcare sector, that should be done quicker, as quickly as possible, because the pandemic has laid bare the inadequacies of the healthcare system. And as Dr. Trehan very rightly said, this is not going to get done immediately. But these steps to actually reach that level have to be taken now, both from in terms of infrastructure as well as trained personnel, because we are lacking in both of them. The Ayushman Bharat scheme has made a good beginning in the first few years, but a lot more needs to be done.
Lot more needs to be done, and I will talk about what needs to be done, what should be the priority of the finance minister in this budget in just a bit. Let's also take opening comments from Professor Anupam Sibal of Apollo Hospitals. Professor Sibal, in your opinion, do you think this 137% increase in budgetary allocation was the right thing? It actually helped India amid the pandemic?
Good evening, Heena. Pleasure to be on your show. I think we all welcomed the increase and the tremendous increase we saw in the budgetary allocation towards health. I think what the pandemic has done is it's brought health center stage. And when a sector becomes a center stage, then there's a lot of interest, whether it's the media, the public at large, or the policymakers. The National Health Policy 2017 talked about the public health spending, the government spending to become 2.5% of the GDP by 2025. We hope that that is brought forward because I think the pandemic has clearly shown that we need to invest more. A lot of the money that was allocated went towards developing the world's largest vaccination program. And I think we all need to get a sense of pride in that we've vaccinated or we've administered 162 crore vaccines, the largest in the world, and we've just about completed 1 year. And if you look at the pace, just look at last week, we're doing about 7 million a day. And if you look at kids between the age of 15 and 18, we've crossed 4.3 crores in 3 weeks. So I think that money has been well spent. We've also seen the government expand the PMJ program. We've had the Ayushman Bharat Digital Mission announced. We've had the Ayushman Bharat Health Infrastructure Mission with an allocation of 64,000 crores announced. And we now are looking forward to ABHA, which is the Arogya Bharat health account. So clearly there's a lot of movement happening. We do urge the government to move forward the government GDP spend to 2.5%. We also would urge the government to consider making health a national priority. And that, of course, means that there will be an encouragement for the private sector to participate in infrastructure development, which is crucial. We've also seen many reforms in health and human resources, whether it's the paramedical or allied healthcare bill, whether it's the National Medical Commission with lots of reforms in terms of increasing capacity, and the government has invested more in terms of education with 22 aims coming up in the next few years, and 157 districts seeing more hospitals, which will become medical colleges. We also see the nursing that's coming up. So clearly there's a lot of movement, and I think the more money we put in, the better it'll be for the country. And also we would seek certain kind of reforms so that the private sector is able to participate even more in improving the healthcare status of our citizens.
Okay. So efforts clearly are needed to further increase the participation of the private sector as far as the healthcare industry is concerned. Mr. Pradeep Multani, in your opinion, as we know that healthcare pharma became the top priority of budget 2021, did that have a positive impact on the sector?
Undoubtedly, just like Dr. Trehan, Dr. Harsh Mahajan and Dr. Sibal said, undoubtedly that increased budget allocation played a great role. After all, to be able to vaccinate 135 crore, I think we've vaccinated, given jabs to more than 135 crore of our population, which is simply fantastic. And all this funding went towards giving these vaccinations at absolutely low cost. And apart from that, having oxygen facilities now in adequate quantity all over the country, in all the hospitals, we are finding that even in this Omicron wave, no one is panicking or under tension, because we know that all this money was very well spent and we are fully prepared for any eventuality. Of course, a lot needs to be done, but looking at the limitations of the government, because the pandemic hit our finances also badly. So under these circumstances, I think that our government has done really phenomenally well. We are very well prepared and the funds have been used in the right way. I would not like to repeat what Dr. Trehan and Dr. Mahajan has said. I fully agree with what they have said. Thank you.
Okay. Now, Dr. Trehan, coming to you about, the bold step that you were talking about, tell us what is it that you're now expecting from budget 2022? Because all seem to agree on one thing, that this increase in budgetary allocation did help the sector. What next? What was the bold step you were talking about?
So picking up on what Dr. Sibal was talking about, the future, how do we approach the future as we move forward? So one thing that was proven beyond doubt was that the reason why we were able to fight the second wave, which was quite devastating, it was because the government and the private sector worked together seamlessly. All the barriers that may have been in the past came down, and we saw that working together can create magic for our country. So I hope that whole process continues, and there's equal support for the government to increase its infrastructure and the other attendant facilities. But at the same time, since private sector is still a major player, and also especially in the space of the quaternary care, we need to be getting our facilities or the private sector facilities out into tier 2, tier 3 cities. And to do that, the government has started some schemes, and state governments have taken some initiatives, which is very good. But the quantum that we need to go put into the ground is quite high, and that will need budgetary support in this budget also, similar to what happened last time. And the point being, like it is clear that the sooner we get to that 2.5 and actually liberalize the education policies, the training policies, which are all actually in the works. And if that happens, I think India can look at a very bright future for the healthcare delivery to our people so that the last man standing on the ground of India should be able to get decent quality care in the next 2 to 3 years.
Okay, Dr. Mahajan, so Dr. Trehan says that perhaps, some kind of budgetary support or some kind of incentives are needed now to improve medical infrastructure in tier 2, tier 3 cities. That's something the government can focus on. What is it that you're expecting this time around specifically? Anything specific that the government should target?
I think, incentivization is a must, especially for private capital to come in. As it is, we know healthcare requires patient capital. It's something which starts giving returns much longer than many other industries. And that's where I think what the government needs to focus on is how to expand infrastructure. And definitely tier 2, tier 3 cities is a must. And for that, we have to have schemes so that we are able to show viability of building new infrastructure, be it diagnostic, be it hospitals, and the Ayushman Bharat scheme, which currently is supposed to cater to about 50 crores of our population, and probably about 20 crores are enrolled as we speak. If it has to go to that 50 crore, and then even, the middle class, which is somehow got squeezed out, there is a scheme for the poor, and the rich actually have their own health insurance, or the employers provide health insurance. Even for the middle class, it can only happen if the private capital knows that there is some return, maybe 5 years down the line, 7 years down the line. So what we are expecting from the government this time is incentivization, which is actually of the kind which has never happened before, so that capital comes in, infrastructure growth happens, and also on the education, training and skilling side, there have to be incentivization and schemes brought in so that very quickly we are able to create a larger workforce. Remember, healthcare is also one of the largest employers that we have in the country. So even for that, we need schemes, and we are hopeful this time that the budget, having been sensitized by 2 years of the pandemic, will cater to all of our needs.
Okay, Mr. Pradeep Multani, usually around budget, the thought and the expectation is that the upcoming budget is going to solve all our problems, and that's the reason why there's always a long wish list that every sector has for the finance minister. Realistically, what is it that can be done? What is it that you're expecting?
Realistically, what can be done is that if we are looking at the government spending 2.5% of GDP on the healthcare sector, the earlier we reach that goal, the better off we are. That is number one. And number two, what I would say is, because knowing that there are financial constraints, I will say just make life easy for the healthcare sector, in the sense that land could be given at cheaper rates to hospitals, for hospitals, medical colleges, and wellness centers. And let there be public-private partnership. The government contribution could be in the form of land, and the private sector would come in and build on it or work on it. Because what is actually needed right now is very clear that the earlier we start providing healthcare facilities at affordable and reasonable prices for a population, the better off we are. And of course, I would say the easiest thing the government can do is let there be ease of doing business. No, I won't use the word business, ease of working for the hospitals and the medical fraternity. Because the sort of rules and regulations which are there on the hospitals, I think there are too many departments which they have to face. Let life be easy for them, let them just focus on it. And I think our doctors and our healthcare sector and our pharma sector is phenomenal. They can do wonders for our country.
Okay. Professor Anupam Sibal, now this was largely about what the industry is looking forward to. But I believe, there is something in terms of tax concessions that's also being sought by the industry. Because for people, like me, the viewers who are watching us right now, for us also the expenditure on health, specifically in last 2 years, has gone up.
Absolutely. I think if we look back at how India fought COVID, one of the things, and Dr. Trehan highlighted that, was that we've seen the public and the private sector come together like never before. The silos were broken. And let me give you 2 or 3 examples. If you look at the ICU beds, you look at the ventilated beds, the private sector had more than the government sector. If you look at vaccines, well, ICMR provided Bharat Biotech with the ability to develop the vaccine, which was developed in the private sector. When it came to administering the vaccines, we have 100,000 centers. Most of the centers are on the government side. So the public sector came in with their strengths, the private sector came in with their strengths, and we cannot ignore the fact that 70% of healthcare delivery in our country is private. The private sector is eager to contribute more, wants to do very much, but would urge a more facilitatory environment to be created. Land, healthcare is a very capital intensive industry. Land costs are astronomical. It is very hard for operators to buy land and make hospitals. Well, there are foreign investors that would be interested to come in and develop the infrastructure, and Indian hospital operators can operate the facilities that will be created. But I think we need a GST regime that's sort of more conducive. And under the rate model, if the operators, currently healthcare operators have to pay 18% GST, and that makes it very expensive for healthcare operators to be interested in actually housing the facilities that would possibly be created. So if that could be looked at, if we look at GST moving from the negative list, health moving from the negative list in GST to 0 rating, if we could have policies, as some countries have done, to promote India as a medical tourism destination, because do remember that the value proposition that we offer in terms of high quality, competitive cost is very attractive. And I think we can get in a lot of revenue. And as Harsh said, when health infrastructure goes up, bed capacity goes up, employment goes up. So I think it's great for the economy. And do remember that we will be charging 20 or 30% more for foreign patients, as is the norm in many countries. So I think we should be able to promote India as a preferred global healthcare destination. And I think that would help get the growth in this sector and also provide tremendous opportunities. So really revisiting some of the land requirements and facilitating that, having a tax regime that's more conducive to growth, looking at medical tourism are some of the suggestions that we have.
Okay. Dr. Trehan, now coming back to you on the aspect of what people can really expect, because people's expenditure, monthly expenditure on healthcare has really gone up. Do you think some kind of tax ops can also be considered to give some relief? For example, one of the expectations that I was reading was that the tax exemption on preventive health checkup probably can be increased from 5,000 to about 20,000 rupees, and medical reimbursement exemption limit can also go up because the cost has actually gone up.
That's true, that as we move forward, there is a yearly inflation, and that will also affects the health sector as much as anybody else. So our costs are always, our input costs are always increasing. Also, the expectation of the employees to be able to keep up with that inflation, our manpower costs also goes up. So it is true that there are many modalities available today which can actually mitigate the burden on an individual. So the government took the big step of the Ayushman Bharat, which actually prevented people who were on the borderline of poverty line from going from above poverty line to below poverty line, which was a real tragedy for our population. So that has been mitigated. That's great. Now, the second thing that needs to be done is to expand the insurance coverage for our population, no matter which bracket they fall into, but they can actually buy incremental products to actually cover the cost as we move forward. So overall, everything that can be done in the government's domain to reduce the cost of delivery of healthcare will help the people. Whatever that can be incentive can be given there, and there are many, many models that can't be discussed right now, but many models available where you can create your own health fund, you can create your long-term insurance with healthcare, and also these products are available today, and as more and more people get insured, the premiums also come down because the risk for the insurance company is spread over a larger base. So these are all things that needs to be encouraged so that we can, and I think Dr. Sibal actually mentioned about the GST. No, we have to pay GST, but we can't charge GST to the patient. One part is correct that we requested it so that the burden on the patient would not be there. But the cost benefit that we could get by reduced GST or a minimum GST charge to the patient can actually balance it off, because paying 18% on every product that we use and also the labor that we use is causing a huge burden on the healthcare system, and that cost ultimately gets transferred to the patient. So we should look at both sides, the supply side and the demand side, how we can match so that there is a reasonable margin left for the healthcare delivery system, which needs to, one, pay back the investment that they have borrowed from the banks, and also to renew itself, because the average life of high-end equipment is about 7 years. So the amortization is very rapid. So if there is a balance of 15 to 20% left for the margin for the healthcare professional, the facilities to actually function in, we can have a very good, robust healthcare system moving forward. So the private sector has to participate in trying to contain the cost as much as possible. The government has to give whatever relief without losing too much money at the exchequer, but introducing these minimum steps which will help on both sides, the supply side and the demand side, so that the patient benefits and the hospital facilities or the healthcare delivery facilities can continue to grow and offer the better and better treatments to the population.
Interesting. Professor Anupam Sibal, now a very important point has been made by Dr. Trehan, and that's about the need to expand the insurance coverage for our population. Your views on this, because, there was another suggestion, in fact, that was there from the healthcare sector, that there should be a healthcare saving fund like PF fund that we have at this point in time, or a PF scheme that we have right now. Do you think something like that can be really helpful in a situation that we are in right now?
Well, I think clearly there is a need to expand the insurance coverage. And when I say insurance coverage, it's also the kind of services that are covered. Conventionally, you've had to admit patients to be able to, for them to be able to avail of their policy. For example, outpatient care is the norm now. After a knee replacement, a patient can go home after 24 hours in selected cases. So the question is, if someone comes in and gets a procedure done in 2 hours, he should get reimbursed. Outpatient coverage needs to be expanded. Preventive health checks need to be expanded. And there should be an incentive for people to look after their own health with their premiums actually coming down. If they make certain changes in their lifestyle, that will prevent them long-term from the consequences of a non-communicable disease. Take diabetes, for instance. Someone who's got diabetes and for 20, 30 years doesn't really manage the diabetes as well, then there are going to be consequences in numerous organs. But insurance does not take into account how a patient is managing his glycosylated hemoglobin and providing better sort of control of his sugar. So there's clearly an opportunity there to expand. I mean, and you mentioned a very interesting idea of a fund. And I think all these avenues really need to be explored, because we have to realize that the cost of healthcare is only going to go up. There's inflation, there's human resource cost, infrastructure cost, technology cost, and also we want whatever is available anywhere in the world to become available to our citizens right there. And then we don't want to wait for 5 years for any technology or any treatment to become available in India. So it's going to come at a cost, because if there's a new drug that's developed, it's going to be expensive. So we really need to account for that as well, and be cognizant of the fact that healthcare costs are going to go up year on year. And so we must have a mechanism where we are able to support that.
Okay. Dr. Mahajan, what is your view? Because, you know, the deduction amount that is there towards health insurance is also very, very low compared to the way the cost has gone up today, the requirement has gone up today. The medical reimbursement limit that we have for exemption, even that amount is pretty low. In fact, that has now been merged with conveyance, and the upper limit is about just 40,000. Do you think that can also be tinkered with in this budget, given healthcare is a priority not just for the policymakers but for the people also?
I think what you've said is absolutely right. Healthcare has to be looked at differently, and there's no doubt that costs are going up in this country as well as globally. Having said that, let me just put something into perspective. India, with the quality healthcare that's delivered, is still the cheapest healthcare delivery system in the entire world. We are cheaper even than our neighbors, Pakistan, Bangladesh, Sri Lanka, Nepal, about 20 to 25% cheaper. The problem here is of affordability. The moment, you don't have insurance and you have to go to hospital for something which is serious, all hell breaks loose. There's so much money that's spent because you haven't planned for it. So that's where I think insurance, whether the government were to help in that, and it could be a co-pay kind of scheme, or people are able to take some money out to realize that maybe not in the next 5 years, but at some point of time they are going to need money for a medical ailment. I think if that thinking were to come in, it would be very, very useful. And you very rightly said the government has to increase the limits so that people actually are incentivized to spend money on preventive health, on finding out what kind of ailments they may have. And frankly, the 150,000 health and wellness centers, as and when they become a reality, I think they can be a game changer, because that's where you will actually get preventive and primary healthcare. And primary healthcare is where public spend has to be huge. And as Dr. Trayan said, tertiary and quaternary care is where the private sector is very, very good, very focused, and that's where also medical tourism is playing a role. So all in all, we have to make healthcare viable in this country for capital to come in, for infrastructure to expand. And one other demand that the healthcare sector has been making for a long time, at least 3 years, ever since the GST regime came in, is that there's trapped capital that is there in the system. And Nat Health, along with the ENY, had recently done a study where it's shown that 5.5% to 6% of our revenues get trapped because GST, as it stands today, is in the exempt category, and the patient doesn't pay. But if from exempt category, it were to be brought into the zero category, the patient still won't pay more, and we will be able to get at least 3-4% of the trapped capital back, making it cheaper for the patient. Right now, all that money, and even before this GST regime came, the idea was that it would be equal before and after it comes into place. This used to be about 3.5%. Now it's 5.5-6% of revenue. Just imagine how large it is. This could also be something which can really make healthcare more affordable.
Okay. Well, affordable healthcare is clearly the need of the hour. The way cost is going up, it is impacting people in any case because of COVID pandemic that we are into. Mr. Multani, now, do you think the government also, can look at expanding the scope of Ayushman Bharat Yojana?
Well, undoubtedly, they should work on expanding the Ayushman Bharat Yojana, but it is for only the maybe the 50% of the poor class. I think schemes like this should also go up to for the middle class and for practically our full population. We should be looking at something like what is happening in the advanced countries, like the national health program in Britain and all. We need some sort of a facility where people can contribute minimum amounts and be covered under their health schemes. And I would also like to just mention here one thing. You see, while we have to make life very easy, because we have the best doctors in the world, we have best facilities, we enjoy an outstanding reputation. Our hospitals and our doctors and our facilities can generate immense revenue for the country. The only thing which we need is that I mentioned on letting there be ease of doing business for the hospitals and other. And I would also like to mention that you see, when we have seen during this COVID pandemics, how miserably countries like America, England, and the so-called advanced countries have done. Now, if India has to reach that level of high, facilities, infrastructure, I think it will take us ages. Now, this is where the role of our traditional Indian medicine comes in, the Ayush system comes in. According to me, we have to have preventive healthcare, work on wellness. Let's make sure our people don't fall sick. Let us focus on Ayurveda yoga, because that is the fastest way for preventive healthcare, and only let people go, let there be very few people who need to be going to hospitals and all, because we'll ensure that they remain fit. The focus thrust should be on that also.
Okay. Now, Dr. Trehan, coming to you on the issue of Ayushman Bharat scheme, we know that it was launched as a step towards universal health coverage, which is also the goal. India is committed to achieving universal health care for all by 2030, which is a fundamental to achieving the other sustainable development goals. Do you think that now time has come to, have our eyes on that particular goal and move towards ensuring universal health coverage for all? What is your opinion?
No, I'm a total believer in that. The point is, how do we accomplish it? Because of the fact that there are any model that you take in the world, you take NHS. NHS in UK is an efficient system, but long waiting lines, many diseases are excluded. Whereas if you are over 65 years of age, you're not entitled to some of the treatments which you deserve. So there are limitations, and people actually pay for it throughout their life. India today, with the mix of population that we have, with lots of people being self-employed or outside the formal employment stream, it's very difficult for them to contribute. So the government has done the right job of covering those people with Ayushman. That is a well-established fact. And the fact that 5 lakh coverage is a good amount of coverage. Now you go step up from that, where we are talking about the next levels of economic strata, that you can co-pay. The government's burden for healthcare for all will be so huge, it will eventually have to come from taxes. Then it goes into a vicious cycle of overtaxing the businesses or individuals. Then it becomes counterproductive. So there are 3 fronts you must work at. One is that there's an old adage which says it's better to predict and prevent rather than repair and repent. So starting the stack from the bottom, if you look at it, what the Ayushman scheme of wellness centers means that once the civic facilities have been provided where clean drinking water, sewage, all the amenities which every human being deserves have been provided at the bottom of every place in India, like the villages to small towns, whatever. Second, build on that is the wellness center, where early detection of any symptoms can be done, and it can prevent huge misery on the patient and a burden on the healthcare system, Because if they come late, then it becomes complicated enough that you have to take drastic measures like surgery or radiation or many other modalities or expensive antibiotics and all that. So if we want to actually reduce all this burden, we actually can plan it in such a way that these facilities are in tandem. It's a stack, what we call the health stack. Then from there, it goes to the secondary care system and the tertiary care system. But along the chain, 50% of the health burden can actually be eliminated. And the rest of the 50% treated early will be much less burden in cost and human misery as we move forward. So I'm looking forward to a very, very healthy healthcare system in India if we continue on this track, which we can be proud of. But also remember, what we need in India, 4 billion other people also need it. All our neighbors, all the African continent, all where healthcare is. But because the cost, if we innovate and Atmanirbhar Bharat produces some of the equipment that we have to import, which is so expensive, and then on top of that, duties and all that, we will be able to bring down the cost. And what we will use in India, the critical mass, can be exported to countries like us, because they are also suffering under the same burden. So there is a ripple effect of good things that we do in India to actually create that goodwill in other countries, because in healthcare, India is more advanced than most of the countries that are emerging or third world or whatever you may call it. But we are much like our doctors are the best, no question. We have the best brains in the world. We just need to match it with our ability to access all the facilities that we need to give the best healthcare at a lower cost, and also ensure the people in such a way that they can access it. So that should be the dream for India. And the sooner we can accomplish it, the better it is.
Okay, interesting. Now I have very little time and I want to give just 10 seconds to each one of you. One thing that you can tell us, if you don't see in the budget this time, you will be disappointed. Dr. Trehan, let's begin with you. Just 10 seconds. Only one thing, if you don't see, Ms. Nirmala Sitharaman talk about, you will be disappointed.
This impetus that came into being last year should be continued till we reach 2.5 very quickly. And also, that the mechanism, there be enough money in the budget so that all the services that are rendered to the different schemes can be reimbursed to the providers on a regular, quick level basis. Otherwise, the healthcare system, especially in the private space, is becoming creaky because of that.
Okay, Dr. Mahajan, 10 seconds.
I would say, incentivization of digital health, telemedicine, which we've seen during these 2 years worked very well, provided access to far-flung areas and was also at very, very affordable rates, and some focus on senior care, and the aging population.
Okay, interesting. Mr. Multani, one thing if you don't hear Ms. Nirmala Sitharaman talk about that will get you disappointed.
I will just say one thing. Number one, let that 2.5% of
only one.
That is number one. And number two, what I would definitely like to say is, we, just like in the case of the vaccine, which are Serum Institute of India and other Bharat Biotech, got out. I think whatever is needed for the country, we have capacity beyond that to export. So these wonderful institutions, these should be encouraged to export. That will generate valuable foreign exchange for us, goodwill for us. If like Pfizer could get $8 billion, such a short time, these sort of companies, and our healthcare and our pharma sector will be bigger than the IT sector. That is the confidence I believe in.
Okay. Professor Anupam Sibal, I give you the last word.
Sorry.
Could you unmute yourself?
Yeah, sorry. If we see the budget last year, we see the trend over the last 12 months in terms of not just the announcements, but actual allocation of funds. If we see everything that's happened, I think it's going to be pretty positive. The markers are there that health is now becoming center stage, and I think the FM is going to make some announcements that is going to be very positive for healthcare for the nation.
All right, we all look forward to Budget 2022, but I appreciate all of you gentlemen. Thank you very much for joining us here on Urban Debate on Mirror Now and helping us understand your expectations from Ms. Nirmala Sitharaman as far as the healthcare sector is concerned. With this, we will slip into a very, very short break, but there's lots lined up for you on the other side as well. Stay with us.